Hello, I'm Dr. Haslam of UCLA Health's Adult Asthma Program in Thousand Oaks. In this video, we will discuss how to use a nebulizer machine for your asthma symptoms. Some patients find that if they have difficulty coordinating classic metered dose or dry powder inhalers, then nebulized medications work better for them. Step 1. Attach the hosing to the nebulizer machine and mouthpiece and plug in the nebulizer. The nebulizer works by turning a liquid medication into a mist that is then inhaled into your lungs. Step 2. Fill the medication vial with the liquid that you have been prescribed. As the medication is turned from a liquid into a mist, you will then inhale the medication from the hosing and mouthpiece down into your lungs. Once you turn the nebulizer on, it will be ready for use. Step 3. Put the mouthpiece in your mouth or face mask over your mouth and nose and breathe normally for 5 to 10 minutes or until all of the liquid has been nebulized through the machine. Make sure that your lips make a tight seal around the mouthpiece while breathing in. A face mask may also be used. Step 4. Rinse your mouth if your nebulized medication includes an inhaled steroid. Step 5. Remember to regularly clean your equipment with soap and water. Thank you for watching this video. Remember to use your nebulizer machine consistently for optimal control of your asthma symptoms.